Let's talk about vaginal weights. Hi there, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. You might have seen these or heard about them. These are vaginal weights, and these are from Intimate Rose. And I want to talk a little bit about how they're used and what they're used for. So you can see there's 6 different sizes here, or 6 different colors. There's 6 different weights, basically. So these vaginal weights, as the name suggests, can be inserted into the vagina to give the pelvic floor muscles a little bit of challenge in order to strengthen. So some of the reasons that you might use vaginal weights is if you are trying to heal from urinary incontinence, for instance, or you're trying to strengthen the muscles of the pelvic floor. You might use it for something like pelvic organ prolapse, again, to work on strength and coordination to allow the pelvic floor muscles the ability to work the way that they're supposed to in the time that they need to work. You might use the vaginal weights, say, post surgery, like a hysterectomy or a pelvic floor surgery, a bladder sling surgery, or even post cancer treatments. Okay, so these weights, like I said, there's 6 different sizes, and we're going to go over a little bit about how you can use them. So a little bit about these vaginal weights. They are nice and soft. They are covered with silicone, and they're very easy to wash and to use. They're all the exact same size as far as how long they are, as well as how wide, the diameter, all of that. The difference, however, is the particular weight. So this set goes from the lightest in color to the darkest is how the weights progress. So when you start to use these types of weights, I recommend start with the lightest, right? Because I want you to feel like you have some control, that you're able to keep this in. If you are dealing with something like prolapse, keep in mind with this, it may take a little bit of time. Because if you have a prolapsed organ that's coming down, it's going to want to push this weight out of the vaginal space, okay? So keep that in mind. I recommend start with some exercise on your back and start with short periods of time. So if you're new to this, maybe you want to start with just a 5-minute exercise session. These weights are not meant to be used to insert and then go about your day for hours on end. That is not healthy for the pelvic floor because it requires your muscles to be contracted in order to keep these in. So it's not healthy to be wearing these for hours at a time in order to strengthen it better. So just like any exercise routine, you want to keep it to short periods of time and really be very intentional with your training. So start with maybe 5 minutes, work up to 15 minutes. So what you would do, I suggest, is to start with some exercise on your back because you don't have as much of the effects of gravity, and you're going to feel like you have a little better control and awareness. You have less moving pieces of your body, for instance, versus say standing. Okay. So you can insert this in. So if this was, inserted into the vaginal opening, you're going to have this string, so to speak, on the outside, which gives you a great way to allow this to come back out. So I recommend start on your back or maybe even in a hands and knees position. And what you want to do is just see if you can do a Kegel, if you've heard of that. So basically using the pelvic floor muscles to contract around the vaginal weight and then relax. And you're not trying to push the weight out. You're just trying to relax those pelvic floor muscles to reset the muscles in between each contraction. I'm not going to go over specific exercises in this video, but I'm happy to work with you if you have some additional questions or if you want some more guidance. So starting on your back and hands and knees, and then working to a sitting or even a standing position is a good progression so that your body, for one, gets used to it, and then you provide more and more challenge for your muscles. Another tip I want to give you, starting the exercises in that progression is a really great way to start. Now, for some people, they want to kind of like just jump in and they want to get started, and finding time necessarily in their day where they can go through this progression can be a little challenging. So, one tip is put this in your shower and use it while you're showering. You're probably in the shower around 10 minutes, give or take. It's a great time to see if you can do a little strengthening with that while you're washing your hair and washing your body and moving around a little bit. That might not be appropriate for everybody because if you have weak pelvic floor muscles, even using the lightest weight, you might not be able to hold this in place. Okay, so give it a try and see if that works for you. And of course, while you're in the shower, you can wash them and keep them nice and clean. Um, but you can try that and see if it works. I do want to mention too that most people think if they have a pelvic floor issue like leaking or prolapse or they have pelvic pain, that they need to strengthen, that they need to do more Kegels, that they need something to make the muscles nice and strong. And I will say that's not the case for everybody. In fact, for some people, Kegels are the opposite of what I would want them to be doing. They might have a tight pelvic floor and Kegels would be inappropriate. It might even make things worse. Okay. So, the best advice I can give to you as a pelvic floor physical therapist is seek out help for this. Make sure that actually doing Kegels and strengthening and using something like vaginal weights is appropriate for your condition. You can always reach out to us here at the Healing Spot. Head to our website, healingspotpt.com, and pick whatever option works out best for you. Talk to us on the phone, ask us the questions that you have, and see if this is an appropriate form of treatment for you. We're happy to consult with you and even book you in for a discovery session where we can sit down one on one to come up with a customized plan to get you feeling better and more confident in your body. Thanks for watching this Ed Talk. I'll see you on the next one.